All right, cool. So we're at 5:26. So before I give an intro, everyone, I want to give a quick disclaimer. So this course is, or this session specifically, is going to run a bit different than we're used to. So because we're talking about ethics, and a lot of you are used to this kind of discussion style in your journal club, we want today to be a time where you all are comfortable turning your camera on, unmuting, and I'm worried that the recording and posting on YouTube will inhibit that sort of thing. So I just want to give a disclaimer at the beginning that it will say it's recording at the top. Like you'll see WebEx is recording, but I'm going to go in after and edit the video and only keep anytime Dr. Bante or Dr. Kate are talking. So like anytime a student is talking, so pretty much most of the video, I'm going to cut that out. So please feel comfortable like turning on your camera, unmuting, giving your thoughts. It's not going to be posted online anywhere. And just message me individually if you have questions about that. All right, so I'm going to start introducing you. So, hi everyone. Today, Dr. Holly Bante and Dr. Kate Sherron will lead a class in the discussion around the complex ethical dilemmas that have permeated the COVID-19 pandemic. Dr. Bante attended Drake University for undergrad and went on to St. Louis University to pursue a master's in nutritional science, MPH in community health, and PhD in bioethics with the focus on research ethics. Dr. Bante currently serves as Assistant Vice President for Ethics in Industry Engagement at UC. Outside of her role in the Office of Research, she teaches the Research Integrity course at UComm's grad school and serves as the bioethicist for both UC's Center for Clinical and Translational Science Training Award and for Hamilton County's Public Health Department. Dr. Sherron attended Miami University for undergrad. After earning her master's in medical ethics from the University of Tennessee, she went on to the University of Cincinnati to earn a PhD in philosophy of science. Dr. Sherron currently serves as the chair of philosophy at Thomas More University. She's a highly experienced educator and teaches courses in applied ethics with particular interest in philosophy of science, death and dying, and interdisciplinary bioethics. And you all may know them because Dr. Bante and Dr. Sherron co-teach the Medical Sciences Journal Club course. So if you haven't already interacted with them yet, you can look forward to exploring medical ethics with them during your senior year. So thank you so much for joining us today for this discussion, Dr. Bante and Dr. Sherron, and I'll let you take it away.
Thank you so much for having us, Nora. So we have some objectives for today, which we'll talk about, but really what we want is we want to have a discussion. You've been thinking about COVID this whole year. Everybody's been thinking about it, right? And there's a lot, almost every day you can open the newspaper and there's something else that has to do with medical ethics. So that's really what we want to do. We just want to kind of guide a discussion today. Dr. Bante, do you want to start with your clip and then we'll go through the kind of objectives and then set out the discussions?
Yeah. Good evening, everyone. Thanks again for the invitation, Nora and others who invited us tonight. We've been excited, and Nora's going to be sharing with you a couple-page document that Dr. Kate put together. And obviously you could tell from that document how excited we were to be here this evening. For those of you who know us, we are very passionate about biomedical ethics. We've been covering COVID-19 to some degree in our undergrad med-sci senior grad class. And so we're excited to see a number of you in the class tonight. And with that being said, we are not going to be displaying any slides. We are here to have a conversation. And as most of you know, the hour will go by very quickly, assuming that you guys will participate and join in, which is what we hope. We know you've had some discussion questions on Canvas, and so we want to revisit some of those as well. But I'm going to show a clip here. It's just a 4-minute clip. And then we can talk about that and some other things. But this has been really in the news as of the last 3 days. It's been a hotly kind of debated issue on vaccine passports. And then hopefully I can get the sound to work. Dr. Kate will have to give me the thumbs up here. But once the clip is over, we'd like to welcome you to turn your cameras on so that we can see your lovely faces and be able to interact with you more personally. So, all right, I'm going to go ahead and give this a whirl and hope that it works. All right. This is a clip from NPR.
This message comes from NPR sponsor Key, a bank devoted to helping clients shape the future of healthcare. Helpful information about healthcare trends impacting your business is available at key.com/healthcare trends.
Now that millions of people are vaccinated and millions of others are not, should you be asked to show a vaccine passport? That's a popular term for a document that shows you got your COVID shots. The UK is piloting such a system, though the government avoids the phrase vaccine passport. Civil liberties advocates, including some in the United States, raised concerns about discrimination. Dr. Anthony Fauci told Politico the federal government is unlikely to require these passports.
You could foresee how an independent entity might say, well, we can't be dealing with you unless we know you're vaccinated, but it's not going to be mandated from the federal government.
The nonprofit organization, the Commons Project Foundation, tried to develop a form of the passport, and Paul Meyer, the CEO of that organization, joins us. Good morning.
Good morning.
I just want to note, when I travel overseas now, there is this yellow sheet of paper with my vaccinations, other vaccinations that another country might ask me to show at passport control. Is that how a vaccine passport would work?
Yeah, exactly. And that's certainly the precedent for this. But right now, most countries in the world have testing requirements. So this is currently in use. For example, right now, you could use Common Pass to fly to Aruba and satisfy Aruba's testing requirements. So it's happening right now for testing, and certainly vaccination requirements certainly seem to be arriving, at least with international travel.
And then your idea, I guess, is a phone app with one of those QR codes, so you just scan it at passport control and everybody would have the same system. Is that your notion?
Yeah, it's not an idea. It's working today. So on all flights, for example, on Lufthansa from Germany into the U.S., people are using Common Pass. People are using it to fly to Aruba, soon to fly to Hawaii. So people use Common Pass to connect to a lab or soon to get their vaccination records. They have their information on the phone, and then they can use that information to show that they meet the requirements of their destination without actually having to hand over the information itself. So that's how it serves to protect.
Oh, so you're saying it actually gives a little more privacy rather than the opposite.
Well, exactly. We don't think you should have to hand over your health records to an airline just to take a flight. But we think there is, and certainly some countries have put requirements in place that you need to actually prove that either you've been tested or you've been vaccinated. So we're trying to let you do that, but do it in a way that protects your privacy.
Okay, we're talking about international travel here, which is a fairly simple case because you're already required in many cases to show your vaccinations. There's already a system. It's already a thing that we do. Does it become more complicated, though, if we talk about domestic use, requiring someone to show that on a domestic U.S. flight or to get into a movie theater or some other big event?
Well, I think there's also some precedent. I mean, most schools in the country require parents to produce their kids' immunization records every September. Most summer camps do it as well. So, and some school districts, I think Los Angeles already announced that they would require vaccination certificates, proof of vaccination to return to school. So this is just like the yellow card in international travel, something that's been done with other vaccines previously. And I think we expect that, some employers, some schools, some businesses will make that decision, but ultimately that's a decision that communities and institutions are going to make for themselves.
But let me give you a chance to respond to the rather overheated language on this on social media or in right-wing television. And you can understand where people are coming from. They kind of have this fear of the kind of show me your papers kind of state. Is there a point at which this would become intrusive?
Well, I think the other way to think about it is there are a lot of things that people are keen to get back to, and being able to demonstrate they and the people that they're going to be with have actually either been tested or been vaccinated is an important in a way of giving people the freedom to get back to normal life.
Well, Mr. Meyer, thanks so much. Really appreciate your time.
Thank you.
Paul Meyer is the CEO of the Commons Project, which developed an app that is a kind of vaccine passport.
From NPR. Live from NPR News.
Okay, great. Now, if everyone can, for those of you who are able and comfortable turning on your camera, that would be great to see you all. And for those of you who may not be able to turn your camera on or don't have a camera, feel free to use the chat to correspond with us.
And maybe we have done ourselves a disservice by not publicizing enough about how really horrible it was to be on a ventilator, how really horrible it is to die alone in a hospital when your family can't visit you, right? It's a weird, how do we take care of each other and not over frighten people, but how do we get people to really realize and take this seriously? It's a very, very odd position to be in.
Well, and I think if we just continue to be honest about the fact that we still don't know very much about this virus, why leave it up to chance? If you have an option to get the vaccine, why take a chance and think that you'll be okay, that you'll be sacrificed? So anyway, but these are things that we continue to wrestle with. And but I really strongly encourage you all to find ways to improve health literacy as you go on in your careers. And I do believe very wholeheartedly that it is your responsibility in your profession to publish. And I'm not saying necessarily in an academic journal that's only read by your peers, but to find ways to get into the community, to find ways to disseminate your work in a way that is understandable and relatable. Because I think that the issue with health literacy, in my personal opinion, I think has worsened. And unfortunately, I think the social media platforms have only exacerbated this concern and have spun all these conspiracy theories and whatnot. And, if people are so concerned about trackers in your arms, they should be worried about their cell phones that actually do track their every movement. So anyway, in closing, thank you guys so much for your attention today and your engagement. We really appreciate it and appreciate the invite, and I hope that you enjoyed the conversation.
Yeah, thank you so much to